that in order to redefine the future of West Louisville, that we needed to understand its history. How we got here, why we got here, and the people who sacrificed so greatly. So today, we're excited to share a project that's been in development right outside this hospital for the last year. 3, 2, 1. With no hospitals or medical practices for people of color in the late 1800s and the early 1900s, the men and women featured in this monument established their own and dedicated their lives to serving the community.
Oh, wow. Wow. This is so tremendous. I am Alice Keene Houston, the proud niece of Dr. John Aaron Cicero Lattimore. And I remember Uncle Doc, most of his patients were treated at Red Cross. He worked so hard against the day laws that prohibited hospitals in Louisville for servicing Black and brown people. What an inspiration for young kids to be able to see the hospital, to see their forefathers who made such an impact on the health community of Louisville.
It means that future generations are going to be able to see and read for themselves the story and the legacy of these pioneers. I am Amy Green Webb, and Marietta Porter Potter was my great-great aunt. To know that a relatively young Black woman became a nurse, she became a physician, she cared for women and children in this community. She had her own practice, her own medical practice. It makes me a little emotional, but just very, very proud. I want to thank Norton Healthcare for what they've done. Having a hospital here in West Louisville is extremely impactful and will truly make a difference in our community.
Funding for this monument was made in honor of the life and legacy of Dr. Richard Wolfe.
It was something that he was actually working on. He and my mother had kind of planned this together, that he would certainly be very proud. He was more concerned about, did the kids get the care that they needed. Certainly he would look at this and say, that was clearly the thought of these individuals long before he ever stepped foot in the community.
Uncle Doc fought so hard to have this kind of facility, so I think he would be tremendously happy and proud. But most of all, he would be appreciative and hold sacred the fact that his patients could be served.